Nearly 1,000 files relating to the NHS contaminated blood scandal are missing from government departments. This has now emerged.
An internal investigation found the files have been checked out by civil servants but not returned.
The government says it knows where almost all of them are and is working on getting them back. Campaigners, though, say it shows previous ministerial statements were untrue. They include Jason Evans, whose father, Jonathan, died as a result of infected blood in 1993. And he joins us now from Birmingham. Mornington, thanks very much for joining us. Just tell us a little bit about your dad and how he came to be infected with these blood samples.
Yeah, good morning. Well, my father was a haemophiliac, and in the late 70s, early 80s, he began to use a plasma-derived medicine called Factor 8, as did many or most of the haemophiliacs in this country, and it would transpire that those medicines were infected with hepatitis C and HIV, and he died as a result of those infections in 1993 when I was 4 years old.
And you, I know, have campaigned long and hard to get to the bottom of what happened, why things happened. Now you've heard about these missing files, and we do understand that government has managed to find most of them. What do you make of it?
Well, I think the fact that they found them is, really nothing. I mean, I think it's absolutely incredible that we've been through 2 inquiries, one of them not being statutory in this country, and that neither of those inquiries would have had access to these 1,000 files. And bear in mind, when we say 1,000 files, we're not talking about 1,000 documents, we're talking about 1,000 folders of documents. And in my experience, each one of those folders contains anywhere from 100 to 300 individual documents. So we're talking about tens of thousands, perhaps hundreds of thousands of documents related to this scandal that until now have not seen the light of day. And I think it's terrible that we've had a number of health ministers who have said all the documents are either in the public or they've been destroyed, and clearly that was never the case, and people have gone to their graves searching for the truth. Over 1,500 confirmed deaths from this, and the way it's been swept under the carpet is outrageous.
And Jason, just I mean, you give us an idea of the scale of what you think might be there. What do you want to happen now to these files? Because presumably you'd like to know what's in them.
Well, of course. I mean, myself and my research partner Andrew March, we've spent a lot of time at places like the National Archive going through the documents that are publicly available, and of course now with the inquiry more documents are being transferred to the inquiry. But obviously we want to see what's in these files. I would allege, and many would allege, the government are negligent for what happened, and we would allege there was a cover-up. The Department of Health said last year they believe at best there was a lack of candour and at worst a cover-up. So we think there needs to be an apology for what's happened here, and also just transparency. I'm sure the Department of Health will have provided some kind of statement saying they are now transparent and they want to work with the inquiry, but it's simply not good enough. And I found there nothing but just a cover-up factory. And if it wasn't for people like Danielle Holliday and Des Collins at Collins Solicitors, I think we never would have got this far as we have. Jason,
I can see you're struggling with your earpiece, but thank you very much indeed for talking to us. So Jason Evans, and as you say, there is a government statement which I will read for viewers as well. The government department are saying we are committed to being open, transparent with the inquiry, have waived the usual legal privilege to assist the process. We have already sent thousands of documents to the inquiry and will continue to send more when necessary.